Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. Please allow me to introduce myself. My name is Reni Chandra Dewi Puspitareni, and I will be presenting the result of our research that has been written in the article submitted for International Conference of Business and Economic of Higher Education School on Economic and Business, Mandala, Jember, East Java, year 2021. Our research title is Community Satisfaction Index in Central Health Community of Maron, Probolinggo, Indonesia. Or in other words, in Indonesia, it is called Indeks Kepuasan Masyarakat di Puskesmas Maron, Probolinggo. The article are written collaboratively by first author, second author, who is me, and third author, as written in this slide. The introduction. We have to understand that public service is the spearhead of government, where it plays a very significant role where they deliver and most concerned with the community health system. Central health community, in other words, I shall mention that what I refer as central health community is Puskesmas. So Puskesmas as central health community plays a very significant role for its geographically close to the community rather than the hospital itself. Puskesmas is also part of the healthcare system in Indonesia. And it is a very specific and unique attribute that I could not find in other country but in Indonesia. And this research is made based on the regulation of Pan RB, the Minister of Bureaucracy and Information Bureaucracy, number 14, year 2017, about the guidelines of Community Satisfaction Index in Public Sector Unit. Community Satisfaction Index, or CSI, has been used as one of the tools. So there are many tools, indeed, to measure the community satisfaction upon which public services are delivered, especially a healthcare service. Community Satisfaction Index also has been used in a wide variety of research. For example, in Puspitarini, which is a research me and my students were performing, identifies the score of City Library, and it is concluded that the CSI is averagely good, although there are some remarks are made. CSI also has been used in another researchers, a multidisciplinary approach, which consists of the researchers exercised by Haryani in 2014, Sukanti in 2015, Wahid in 2021, Widnyana, Nopianti, Petria, and Syafriana. Both of them has a general similarity with the research I with my teams carried, which is the Community Satisfaction Index. The important remarks also made by Ekadipta and Sularsi in 2019, where the Community Health Center research of measuring customer satisfaction index moved to measure in some specific aspect. For example, Ekadipta research on medicine receipt information, while Sularsi has research on outpatient services. Another very important remark is a strong remark about CSI and important performance analysis, which has become an analysis we use in the research made by Xavier in 2015. What we can infer from the previous set studies that Puspitarini research employs the same method, which is measuring the communication satisfaction index, with the difference do not include or did not include the important performance index, while Haryani and the rest up to Syafriana does not include the regulation as the initial importance of their research, but they are using the tangible reliability, responsiveness, assurance, and empathy as 5 aspects. And thus, although methodically they are the same with our research, but the services are very general. The unique approach have been made by Ekadita F. Sularsi, as I have mentioned before, and strong remark were to consider analysis to make the analysis more rigor, more in-depth by addressing the incompleteness of IPA and proposing and promoting the ROC or receiver operating characteristic analysis. Let's move to the methodology. Still have the methodology. So the flow of research is we initiated from the community satisfaction index based on the central government regulations, and then from the CSI index scores we score the balance measurement, and we also score the importance performance analysis, where in the end we generate a 4 diagram of explanation. Measurement. The measurement we are using the measurement of 5 scale Likert, and there are 150 respondents of users who are defined as respondents that were randomly selected as they are receiving services, visiting, and having experiences in Puskesmas Maron. These are the results. So what we must see in this research, what we must look at attentively in this research is the total value of per unit and the balance value. So this is what we must see. And on the second table, what we must see is the total expectation of index value, the balance average per unit. So what we should keep in mind is this score 2.997 and 3.334. These two values are very significant to build a Cartesian diagram in our final result. And then based on those scores, we created what we call as DISCONFIRMATION of expectation model, which is using an IPA analysis. So where are the scores that we must look at? What the score we must look at is the total value of X performance and total value of Y expectation of U1 up to U9. The terms defined U1 to U9 are made based on the regulations. And then what we should see that the average value is 2.937 and 3.355, which then we transfer to define the balance scale. So then we create red dotted lines which define the rooms, which is where Y is represented by X, and performance is represented by X. So Y is represented as expectation, I repeat, and X is represented by performance. And then we identify where these values belong. And then we group those values from U1 to U9 to this group. This is called a primary priority, or we can call concentrate here. Quadrant 2 is something that must be maintained. Quadrant 2 is something that we find very excessive and less important. So the explanation will be that U1, U2, which is consists of requirement and service procedures, are two aspects that must be maintained. And the aspect where the manager, which is this recommendation for the manager, is something that the manager must be concentrate more is on service time, implementer competence, implementer behavior, and complaint handling. Those results are concluded in this conclusion. So what we can infer that the community satisfaction index is averagely good, and then there are some recommendations can be made for the manager to increase the performance of the central health community in Maron. So probably that will be the end of my presentation, because I have been running out of time. I only been given 10 minutes, no more. So that's all what I can say, and we are looking forward for the discussion in the next minutes. So I should say, stay well, and wassalamualaikum warahmatullahi wabarakatuh. Bye-bye.